Hello, my name is Lindsay Kuznar. Today I will be performing a head, ears, eyes, nose, and throat of my patient who has consented for this video. First, I'm going to assess your skin. There's no lesions noted. Skin is intact, warm, dry to touch. Fingernails, no clubbing noted. Cap refill is good. Skin turgor is good. That's perfect. Okay. I am going to assess your hair. No alopecia noted. Hair is full, thick. No lumps noted on his head anywhere. I'm going to assess your cranial nerve 5. I want you to close your eyes and let me know when you feel me touch.
No. 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 No.
Perfect. Next, I'm going to assess your sinuses, your frontal. Let me know if you have any pain.
No. No.
Maxillary. Perfect. I'm going to assess your temporal arteries. Going to palpate them. And then I'm going to auscultate them with the bell of my stethoscope. No worries noted. Okay. I assess your neck. It's symmetrical. The trachea is midline. And no JVD is noted. I'm going to assess his thyroid. I'm going to have you turn to the left and then turn to the right. And I'm going to have you swallow. Perfect. It felt even going down. Now I am going to assess your lymph nodes. So we are going to fill the auricular, tonsillar, submandibular, submental, supraclavicular above the clavicle, infraclavicular below it. We're going to do the anterior cervical, posterior cervical, and occipital. And all of those feel good. Going to move on to your eye assessment. After I assess, I'm going to have you push up against me, shrug your shoulders, turn your head left to right. Perfect. I'm going to check the conjunctiva of your eye, from the bottom, the iris, pupil, the lacrimal gland. No tearing noted. Eyelashes look good. We are going to perform the Rosenbaum test. Wrong paper. And with this paper, we are going to have him read. I'm going to have you cover one eye and read this bottom line.
LTFPH.
Okay, and the other?
LTFPH.
Okay, perfect, that's great. Now we're gonna assess the complications of your peripheral vision, so I want you to let me know when you see my fingers.
No. No. No.
So that is his peripheral vision fields. So that is perfect. We're gonna assess your 6 cardinal fields. I want you to follow this with just your eyes, please. 2, 3, 5, and 6. Perfect. I am going to assess now my ophthalmoscope. Just turn it on. The optic disc, and I'm going going to first, to use this, I will assess using my right hand, right eye to his right eye. So I will, my left-handed, and I have noted the red. And I will go in and adjust as needed. Until I have seen off the tip, which is an orange color. We will move to the other side. Same with this side. We will do the left hand, left eye to left eye. Now with the red light. And the optic disc is orange as well. Check your accommodation, have you look at my finger and look at the wall. Look back at my finger, look at the wall. Perfect. And we're also going to check for pupil reaction to direct and consensual light. So we will do direct, pupils reactive. Okay. For the consensual, I'm going to look at the other eye while I'm direct light on you. Perfect. React, and we'll do the same thing. Perfect. Okay. I'm going to have you do what we call the cover test. I'm going to have you cover your eye. Hold it down. Cover your eye. Perfect. And the eyes, yep, they stayed. Perfect. We're going to check your lid lag. I'm going to have you look up and down, and I note no lid lag. Okay. I'm also going to assess for the light that they will direct are the same from your nose. It reflects on both eyes in the same area. Perfect. We're going to move on to your ear inspection. I'm going to switch out. And for the ears, visual inspection, they look well, intact. And for the otoscope, I'm going to hold it in this way, hold the ear up. I'm going to be looking at the tympanic membrane. I'm going to rest the side with my hand on his face. And the tympanic membrane is noted and it is translucent in color. We're going to go to the other side and do the same. Tympanic membrane is visualized and it is translucent and intact. Now we're going to perform what I call a whisper test. I'm going to give you a series of numbers behind while I'm closing one ear, and I want you to repeat what you hear.
3, 4, 5.
Okay.
6, 7, 8.
Perfect. The next test is what we call the Renee test. I'm going to have you, I'm going to pop this on my elbow, have you tell me when you stop hearing the noise behind your ear and then next to it.
No.
Okay.
No.
Okay. Now we're gonna do what we call the Weber test. I am going to make the noise and put it in the middle and let me know if it's equal.
Yes.
Perfect. Now we are going to move on to assess your nose. It's intact. I'm gonna assess your mouth, your tongue. Can you do your tongue side to side? Perfect. Let me assess your teeth and your gums. Everything is intact. Also going to assess your cranial nerve 9. Have you said ah? Okay. And I also see your tonsils, and tonsils are graded a 2. And this concludes our head, ears, eyes, nose, and throat assessment of the patient.